Good afternoon. My name is Avantika Bhardwaj. I'm a fourth-year PhD candidate in the School of Allied Health in the Faculty of Education and Health Sciences. Slide, please. They say we don't truly appreciate what we have until it's gone. Now imagine waking up with knee or hip pain every morning. Imagine experiencing stiffness or swelling in your joints every day. Imagine that this pain affects your daily life, from household activities to walking and driving, to even just standing up from the chair you're sitting on today. And now imagine that on top of all of this, you also find it extremely difficult to access treatments like exercise that are evidence-based and meet your needs. That doesn't sound great at all, does it? Well, that's what it's like to live with osteoarthritis, or OA, a condition affecting 1 in 8 Irish people. A condition so prevalent that everyone in this room probably knows someone with OA. From 1990 to 2019, the number of people with OA rose by 48% worldwide. And the World Health Organization estimates that this trend will continue given that we are living longer and more inactive lifestyles than before. So the time to act is now. I was determined to better understand and provide research, policy, and practice with more specific knowledge on what works where, why, and for who. In other words, what are the most important barriers and facilitators to evidence-based treatments for OA, and are these shared or different between individuals or healthcare settings? This targeted information would help us reduce existing costs, improve access, and ease the burden of OA. So, I've done a synthesis of the literature from the last 20 years, and I've collected surveys from and completed interviews with people with OA and healthcare professionals like physiotherapists and general practitioners across public and private settings. What I found was that education, training, and community-based resources like workshops or flyers that are low cost and adaptable are important and needed regardless of someone's role or setting, while factors like space, funding, or staffing levels may be more relevant in public settings. Ireland has a higher number of people with self-reported OA compared to similar populations worldwide, and my framework could be used and adapted to other conditions, treatments, or settings to develop new models of care that are proactive, more likely to be effective, and ensure that resources are being used in the best possible way. Ultimately, my research provides a comprehensive insight that enhances and supports national and international efforts. So, instead of waking up every morning with knee or hip pain, you would receive access to the optimal or most favorable treatment in the right place at the right time. Thank you for listening.